The electrical impulses sent from our brain to our spinal cord control every move we make. Every blink, every flex, every step we take is a result of what happens here. So when these signals are blocked or disrupted by a neurological injury, the simplest movement can be impossible. Such is the case with the occurrence known as foot drop, an impairment that leaves a person unable to walk because the foot and ankle muscles aren't functioning properly. A misunderstood diagnosis, foot drop is often thought to be a disease, but that's not the case at all.
It's actually a symptom of any number of different conditions or injuries somebody can have. It sort of falls into two categories. Foot drop can be from injury to the spinal cord or to the brain, seen not infrequently in stroke, traumatic brain injury, spinal cord injury, multiple sclerosis, cerebral palsy. The second type of foot drop, and it's important to distinguish the two because they're treated very differently, is a foot drop that's due to damage to the peripheral nerves. This would be something like a peripheral neuropathy, damage to one of the nerves in the leg, and quite commonly after back surgery to the L4, L5 nerve root.
6 years ago, I had a stroke on my right side. It was completely paralyzed. I wasn't able to walk at all. They fitted me for a brace, and my walking was slow and difficult, and it was not in any way normal.
Because the foot and ankle muscles can't respond properly, the person afflicted can attempt to walk, but not without difficulty. Here at Health South Rehab Hospital in Sunrise, Florida, Betty Stevens is undergoing physical therapy for foot drop and is making great strides thanks to a device that helps the muscles respond, allowing the patient to maintain a normal gait when walking. In fact, recent technological advancements are helping this patient population in regaining function and mobility and improving quality of life.
When Betty started using the electrical stim technology, it gave her more improved gait pattern. It allowed her to have some more normal movement patterns so that when she was walking, her pattern was more efficient. She was able to walk better on uneven surfaces. She was able to go up and down the stairs better. The technology provides the ability to allow her leg to move properly when she's coming down the stairs, so she's safer and she's more coordinated.
The concept of using electrical stimulation for foot drop is not new. It's a pretty simple process. There's surface electrodes that go over top of the nerves that stimulate the muscles that contract the ankle and the foot, specifically the muscles that help lift the foot while the patient is walking. To do this, to make it simple for the patient, we house those electrodes into a stimulation cuff. This makes it very easy for the patient to put the system on and off. We also use a wireless sensor that fits into the shoe. This communicates to the system and tells it when the foot is on the ground and off the ground. So we synchronize the stimulation pattern for when the patient is walking. And the patient also has complete wireless control of the system through a control unit. This allows them to adjust the intensity if need be, or adjust the mode settings. They can use exercise mode or gait mode depending on their activities and what the goal of the stimulation is for that day.
There was a time when certain medical ailments couldn't be treated. Those days are over for people like Betty, who can continue to move forward in life without missing a step.
Now I'm much more independent. I can walk myself around the block. Having this Bioness device has just really, it's given quality to my life.
Do you or someone you know suffer from foot drop? Are you bound to a wheelchair or hindered by cumbersome ankle-foot orthosis because of foot drop? If so, talk to your doctor about the Bioness L300 foot drop system. This revolutionary technology is designed to help people with certain neurological conditions walk more naturally with increased speed and improved balance. The Bioness L300 does so by delivering electrical signals to activate nerves and muscles that lift the foot, giving users the freedom of mobility. And studies show that the use of the L300 significantly reduces falls and results in immediate and long-term improvement in walking speed. The wireless design is comfortable and lightweight, making it easy to stay focused on doing what you love most. And the Bioness L300 is now also cleared for use with pediatric patients, so just about everyone can benefit from this extraordinary technology.
The advantage of the functional electrical stimulation systems are that they are relatively well hidden. There's not the aesthetic issue. They can be turned on and off during the course of the day. Often foot drop will bother somebody most at the end of a long walk or at the end of the day. Having the ability to turn the device on and turn the device off allows a patient to choose which part of the day or which part of an activity the foot drop system is actually in use and active. The best candidates for this technology are individuals that have damage to the spinal cord or to the brain, individuals that are already walking fairly well to walk a little bit better.
Because the Bioness is able to give the patient the timing and coordination that they need, they're able to get better quicker. They're able to progress faster and we're able to get them back into their normal life sooner.
But the innovations don't stop here. Bioness Incorporated, the creator of the L300 foot drop system, also offers technologies that help with hand paralysis as a result of stroke. Company leaders are committed to always staying ahead of the curve.
Bioness prides itself on leading the industry in technology advancements. We will continue down that path to create solutions for clinicians and patients in the rehabilitation space.
Get in step with the latest breakthroughs in gait rehabilitation and enjoy walking again. Find out more. Visit bioness.com or call the number on your screen.